Joint pain? Digestive discomfort? Chronic inflammation? Could the answer you're looking for be something you already have in your kitchen? There is one herb that has been used for thousands of years to help the body find balance naturally. Chronic low-grade inflammation has become one of the most common underlying patterns seen in modern health. It often shows up as joint stiffness, digestive irritation, fatigue, or a general sense that the body is not moving or recovering as it should. From a holistic perspective, these symptoms are often linked to stagnation, when circulation, digestion, or metabolic processes slow down and lose efficiency. When healthy movement is restored within the body, inflammation can resolve more effectively, tissues repair more efficiently, and overall resilience improves. Rather than suppressing inflammation, holistic medicine focuses on supporting the body's natural regulatory systems and addressing the underlying patterns contributing to imbalance. One of the most well-known of these plants is turmeric, also known as Curcuma longa, a medicinal herb with a long history of use as food, medicine, and natural pigment. Turmeric is native to South and Southeast Asia and belongs to the ginger family. In traditional systems such as Ayurveda and Chinese medicine, it has long been used to support digestion, metabolic function, and healthy circulation. In modern clinical herbalism, turmeric is considered a gentle and adaptable plant, often used for long-term support rather than short-term intervention. The medicinal portion of turmeric is its rhizome, an underground stem rich in bioactive compounds. Traditionally and clinically, turmeric is known for its antioxidant and anti-inflammatory properties. It has been used to support liver function, encourage bile flow, promote digestive comfort, and assist tissue repair. Turmeric contains a complex range of active constituents. These include curcuminoids, volatile oils, polysaccharides, and other compounds that work together to support inflammatory balance and cellular resilience. As turmeric gained scientific attention, research focused on identifying the compound most closely associated with its effects on inflammatory processes. Once curcumin was identified, supplement companies began isolating it from the plant in an attempt to enhance its anti-inflammatory effect. Highly concentrated products were created, often consisting mostly of curcumin, while the rest of the plant's natural compounds were removed. This approach often produced little to no benefit. Herbal medicine works with whole plants. Their compounds interact and function together as a system. When curcumin is taken on its own, these interactions are lost. The body often does not recognize isolated curcumin in the same way and clears it quickly. That is why turmeric's effects cannot be reduced to a single compound. The whole plant matrix contributes to its overall activity of supporting digestion, circulation, liver function, and metabolic activity. Turmeric is best used as a full plant preparation, including tinctures, dry extracts, or powders. It is generally well tolerated. Mild digestive discomfort may occur, and caution is advised for individuals with gallbladder conditions or those using anticoagulant medications. For best results, consult a clinically trained herbal medicine practitioner to determine the most appropriate form and protocol for you. Bring the body back into flow, the natural way. Lasting wellness begins with daily habits, clean nutrition, regular movement, stress management, and restorative sleep. Give your body the tools it needs to support circulation, digestion, and recovery.